You may ask yourself, why is it important for anyone wishing to apply CBT with older people to understand what normal aging is? Well, simply put, unless one understands what the usual or the normal experience of aging is, one cannot hope to differentiate this from what we may think of as abnormal aging. Unless a therapist understands what's normal from abnormal, there is a risk the depressed and anxious statements that our clients make will be unquestionably accepted as facts. In depression and in the anxiety disorders, cognitions, which can be thoughts or images, are stated with great conviction and are believed by our clients with absolute certainty. We as therapists, on the other hand, need to assess whether the statements our clients make in sessions are factual accounts of the normative experience of aging. Being able to understand normal from abnormal aging will help us in that task. Equally, in order to help our older clients become active participants in CBT and agents of their own change, we need to consider how to respond if a client contributes the maintenance and development of their problems, primarily to do with aging. To add to that, we also need to question our own implicit assumptions and attitudes to aging. Older people as a group are exceptionally diverse, as this population grouping contains 4 generations within it, and chronological age is the least useful piece of information to consider when working with an older person. There are as many individual experiences of aging as there are older people. The stereotypical view of old age is it's all inevitably about loss and decrepitude. However, the picture that's beginning to assert itself is that of variation, adaptedness, and psychological growth. Older people can modify their environments and their responses to situations to reduce the likelihood of aging being a negative and dispiriting experience. Longitudinal work by Laura Carstensen and colleagues based in Stanford University in California over many years has shown that, contrary to expectations, there are a number of gains associated with aging, and rather than becoming more rigid in later life as people age, they become more open and less set in their ways. As people age, they get better at emotion regulation, with Laura Carstensen's research demonstrating that older people experience enhanced levels of emotional stability in comparison to adults of working age. Research evidence also suggests older people overcome adversity in later life, such as loss or illnesses, by active and proactive self-regulation. As such, older people are more able to adapt to living with a number of long-term conditions while still retaining high levels of life satisfaction. Self-regulation in later life is often anticipatory and primarily focused on investing one's resources, both psychological and emotional, to reduce losses to the minimum level. In CBT with older people, the focus may be about optimizing and maintaining functioning in the presence of significant losses and challenges. Let's look at some facts about aging and mental health in order to start addressing the question of what constitutes normal aging. Let me state quite clearly, depression, the anxiety disorders, and the dementias are not the normal experience of aging. Neither are they the normal outcome of aging. Rates of major depressive disorder, often known simply as clinical depression, are actually lower in older people than in adults of working age. It's a very common misperception that depression rates would be higher in later life because of the challenges that sometimes come from the experience of aging, such as bereavement, change of roles after retirement, changes in experience, etc. Professor Joel Sadovoy, a well-known psychotherapist and university professor at Toronto in Canada, writing in 2009 in a thought-provoking paper about working psychologically with older people, notes that depression is surprisingly uncommon when one considers the challenges posed by older age. Rates of major depressive disorder range from about 1 to 8% of older people, depending on where you look, But there is a consensus that symptoms of depression may be present in up to 15% of community-dwelling older people. Of course, when we consider comorbid conditions that may be more common in later life, then rates of depression are higher. For example, 15% of medical inpatients may meet criteria for major depressive disorder. When we look at longer-term medical conditions such as stroke or Parkinson's disease, rates of comorbid depression and anxiety may be much higher still. Remember that neither stroke nor Parkinson's disease are considered to be the normal aging experience. For those of you wanting to read more about depression rates generally, you should follow hyperlinks in this module to a recent paper by Amy Fisk and colleagues writing in the Annual Review of Clinical Psychology. We've talked a lot about depression, but anxiety disorders are very often under-recognised and under-treated in terms of their impact on well-being and for the long-term consequences for older people in terms of physical and emotional health. The key thing is to remember, neither depression nor anxiety disorders are normal outcomes for aging, and these are conditions that can be treated effectively with evidence-based psychological therapies such as CBT. In summary, normal aging may bring a number of challenges such as long-term conditions and bereavement and loss, but depression is not an inevitable outcome of these experiences. And most older people experience this stage of life as one of growth and satisfaction.